In this presentation, we will discuss about the relevance of WASH and IPC activities to be implemented in densely populated settings to reduce and mitigate COVID-19 transmission, and where relevant, it links to health and education as well. In order to identify key interventions, it is important to initially map ongoing WASH services in the target areas for which we will present a few ideas. We will then take you through the key WASH subsector activities that include interventions in water supply, environmental sanitation, and hygiene, along with examples of new and adapted activities to be put in place during the pandemic. At the end of the session, we will also highlight the key takeaway points. Densely populated settings, particularly in low and middle income countries, pose a significant risk for uncontrolled COVID-19 transmissions. Slums, refugees, and internally displaced settings in camps and informal settlements as well. But also market and other public places where persons may gather, like religious buildings, parades, demonstrations, which are often densely populated with very limited or basic services, including wash, shelter, and income. It is critical that IPC and WASH activities are planned carefully and implemented in these areas. Additionally, secondary impacts of COVID-19 can further disrupt functionality and access to WASH services and commodities, hence increase also exposure to COVID-19 and other WASH-related diseases. Not addressing lack of adequate minimum WASH services in COVID-19 will reduce ability to achieve outcomes for improved health in camps, community, and institutions such as schools and temporary learning spaces. The following advices take into consideration various sources around WASH in densely populated areas during the COVID-19 pandemic. In densely populated settings such as informal settlements and or camp or IDP settlements, minimum WASH activities highlighted here are very challenging to implement and also increases the risk of transmission significantly. This guidance is put together, therefore, taking into account various sources advising and providing tips on addressing this in densely populated settings. It is frequently the case that there is a lack of adequate data and information on informal settlements, the layout and its infrastructure and services as well, which may make the planning and responses to COVID-19 very difficult. This information can be collected through secondary data review and interaction with the community, other NGOs, UN agencies, local authorities as well. Consultation may happen through face-to-face interviews and site visits only where it is possible, and remotely through phone calls, videos, and other social media platforms. Where there is a high risk of transmission and where national movement restrictions are in place, it is important for us to make sure that only non-face-to-face modes are selected. To have an understanding of WASH service status, it is important to assess with the community for the existing and missing WASH services and commodities. Map the existing WASH actors that include authorities, national and international organizations, UN agencies, camp and informal settlements, management bodies, and community-based organizations as well. Assess links among those stakeholders and map their existing capacities and coverage in collaboration with local coordination mechanisms such as the WASH cluster, the government, private companies, public and private partnership, users or communities, and their representatives as well. Map the risk factors and the health conditions in the community. This is to prioritize and define activities in different areas of the settings, for instance, underlying health conditions that make a specific group more at risk or vulnerable to COVID-19 transmission. It also does make it important for us to look at the proximity of some of the highly vulnerable locations such as open landfill, etc., and also negative coping mechanisms of waste pickers in particular. Ensure that the gaps and needs in WASH and institutions such as health and healthcare facilities and schools are addressed in the assessments also. We will now go through interventions that could improve and increase access to water, environmental sanitation and hygiene, including new and adapted activities that should be put in place to reduce the risk of transmission of COVID-19. As mentioned earlier, Densely populated areas in low and middle income often lack adequate access to water supply services. Demand for water is expected to be significantly increased to comply with improved personal hygiene that reduce COVID-19 transmission, such as hand washing, which is increased, cleaning and disinfection of surfaces, etc. Though there is no evidence of COVID-19 being transmitted through contaminated water, coronavirus can survive in non-chlorinated water. It is therefore important to treat water with chlorine as well. Additional water may be provided through water trucking or through construction of additional water points. Water consumption should be assessed and regularly monitored through consultation with communities to readjust the activities according to the real needs. Distribution of additional storage containers must also be considered. Water in hot spots like camps must be chlorinated. The engagement with community is essential in this phase, particularly as value of residual chlorine needs to be regularly checked at household level to adjust chlorine quality as needed. Community health volunteers with adequate precautions considered can also support in this type of quality control. Practice of hygiene behavior as a barrier to COVID-19 transmission must be enabled through provision of hygiene commodities. All the community group representatives should be consulted to identify and list household hygiene commodities needed. The local market and its prices must be assessed to understand how better commodities can be provided through in-kind contribution or cash or vouchers. For distributions, SOPs should be developed together with the community to ensure risk of COVID-19 transmission is minimized by enhancing social distance and hand washing as well. Provision of soap and other household cleaning products and touch-free hand washing facilities for households and public places should be prioritized. Location of public hand washing facilities should be discussed with the community. Making hand washing attractive, comfortable, and fun is important too, particularly for children. Discuss its design with users and use nudges to encourage hand washing in public place, along with stickers and mirrors that can contribute to making hand washing last for at least 20 seconds. Water collection in densely populated settings may pose a high risk of transmission, particularly when time spent queuing at water point is high. People may gather around taps, increasing interpersonal contacts. To avoid gathering and allow social physical distancing, water taps numbers must be increased and taps must be located 2 meters distance from each other where possible. Functionality of water points could be extended and a schedule for fetching water organized as well. Additionally, maintaining a fixed schedule will reduce unnecessary queuing and congestion at water collection points. Visual nudges like circles painted in the ground or wooden sticks picked at 2 meters at distance, one from another, will help in keeping an appropriate and safe distance between water point users while queuing. In reducing the risk of transmission through contact, taps and manual pumps could be disinfected regularly using 0.1% chlorine solution or converted to foot pedal systems to avoid hand touch. Hand washing could be installed at water points to wash hands before and after fetching water as well. For this solution, engagement with community is essential to guarantee constant availability of water and soap. In locations where it is very hot and humid, it will also be good to provide places with shade or rest since queuing times might be much higher. Use and maintenance of shared latrines and showers in crowded settings may generate gathering with increased interpersonal contact. Use of shared facilities increase the risk of transmission through contact with highly frequently touched surfaces. To mitigate those risks, we must consider to paint 2 meters nudges to facilitate safe distance between queuing users, increase the number of gender segregated showers and latrines, ideally to be single family use where possible, or particularly to be used by a smaller cluster of families. The community can participate to cubicle constructions if provided with adequate latrine constructions, tools, and materials. Community inputs are essential to establish women and pregnant and lactating women adaptive design and the location of the new infrastructure. Public facilities should be cleaned with water and detergent first and then disinfected with 0.1% chlorine at least twice a day. Hygiene kits with PPE for cleaners must be provided in kind or through cash transfer or voucher systems. To limit transmission through contact, hand washing facilities with 5 meters from the facilities must be installed. Community engagement is essential to ensure that there will be water and soap and which is regularly refilled. Use the opportunity to address aspects that may not have been previously addressed, such as facilities for people with disabilities, provision of lighting, and other locally relevant protection interventions as well. Though COVID-19 transmission through grey and black water has not yet been reported, it has been demonstrated that COVID-19 can survive in chlorinated water. Grey water is all the wastewater that comes from a kitchen or bathing showers, while black water is sewage. Infectious virus has been detected in feces and urine of COVID-19 patients, suggesting that fecal-oral transmission may be possible. In preventing the risk of transmission, the following can be implemented. With the community, map the areas where there is stagnant water and plan construction of drainage facilities. Train community wash committees and service providers to safely implement desludging through use of PPE and personal hygiene behaviors. Ensure sludge reach functional phase treatment plants after leaving the setting and it is not unsafely disposed. Disinfect and decommission non-functioning latrines. Constitute a contingency stock of relevant tools and spare parts like desludging pump and PPE, including boots, heavy-duty gloves, vests, eye protection, and where possible, N95 respirators as well. Transmission of COVID-19 can happen through contact with solid waste, particularly with hazardous and infectious waste like used masks and gloves and household healthcare wastes. To avoid risk of transmission, the following can be implemented. With the community and authorities, map the hazards such as unofficial waste dumping areas and available waste collection and disposable areas. With the community, design messages on importance of safe collection and disposal of hazardous waste and spread those through effective channels. Provide labeled containers for disposal of general and hazardous waste in public areas. Support community in safely implementing cleaning campaigns through training and distribution of cleaning tools and PPE. Liaise with the community and authorities to ensure waste disposal and destruction happen in adequate facilities such as authorized landfill and healthcare waste management areas. Provision of wash and IPC services and commodities is not enough to reduce the risk of COVID-19 transmission. Improved personal hygiene behaviors are critical in reducing risk of COVID-19 transmission. More information on this is provided on the behavior change communication topic and the RCCE module itself. The importance of hand washing, use of chlorinated water, use of safe excreta disposal, safe solid waste management, cleaning and disinfection must be understood by identifying key barriers, limiting or preventing these behaviors. These interventions must be informed by evidence and data. Though the delivery of key messages is important, engaging the community to identify these messages together and find a way to address the barriers that limit or prevent key hygiene behaviors is as important too. The community must also be consulted and engaged in identifying locations for infrastructure such as hand washing that contribute to improved hygiene behaviors. To ensure all the affected persons are reached and understand barriers to COVID-19 transmission, messages crafting must be based on risk perceptions and feedback data collected. Messages must be translated into local languages and adapted to understanding capacity of each affected group, such as children, persons with disabilities, and illiterate people as well. To design an effective hygiene promotion program, it is important to work closely with the community on the following activities. Assess what prevents the practice of hygiene behaviors. Design and put in place feedback and complaint mechanisms. Design and put in place rumor tracking systems. Map all the groups in the settings and consult representatives of each of those to adapt the messages, assess and decide where available and effective communication channels to reach each of the affected groups. Where face-to-face interaction is only option, train additional community hygiene volunteers to form smaller audience groups. Volunteers should be trained on inclusive communications too. Channels selected through community consultations to spread messages must guarantee a two-way route of communication. This is fundamental to ensure we constantly adapt messages to the evolving context and to the needs of affected persons. To safely deliver message, the remote way should be preferred in the COVID-19 context. Social network, WhatsApp groups, phone calls, SMS, radio broadcasting, television, and loudspeakers. Where media coverage is absent or none of the above is possible, face-to-face interaction can happen, but protective measures such as social distance, use of masks, and regular hand washing must be enabled. With adapted SOPs, messages can be spread through focus group discussions, question and answer sessions, house-to-house visits, engagement, and training of community and religious leaders too. There is more detail on how to enable this conceptually and operationally in the RCCE module. Secondary impacts are defined as those caused by the epidemic indirectly, either through the effect of fear on the population or as a consequence of the measures taken to contain or control it. Acknowledge that countries will experience secondary impacts on wash services in different ways, depending on the underlying strength of the economy and social services, the type of measures taken to the virus, and their durations also. Examples of secondary impacts can be limited access to wash services due to quarantine and movement restrictions. All of the above cited secondary impacts could lead to an increased incidence of wash-related diseases, including a potential for outbreaks such as cholera, where the disease is already active. They will also impact overall improved health in the community and cause increased absenteeism in schools too. The CHP module will go a bit more into detail on how to address integrated health response to minimize further impacts of COVID-19. As secondary impacts of COVID-19 can limit access to water services and commodities, it is essential to work together with the community, users, community-based organizations, vendors, and service providers, and local authorities, including UN and non-governmental agencies, to be prepared and mitigate this by improving and maintaining the functionality of essential services. Training of additional community members to support daily operations such as chlorination and ordinary maintenance is one such example. Convert to solar supply system to avoid dependence from fuel and generator that require frequent and specialized maintenance. Have a contingency stock of consumables for water treatment, fuel, and spare parts that is needed at least for 1 month in case of continued lockdown. The RCCE module covered critical aspects of working closely with the communities. It is imperative that the IPC and WASH response to COVID-19 to be effective, it must reach all groups, particularly the most vulnerable. To reach children of different ages and with special needs and protect them from disease transmission, hygiene and COVID-19 related messages must be designed in a format that meet the need of those who may have difficulty in seeing, hearing, or understanding information. Wash facilities such as hand washing, water taps, and toilets must be adapted to their users, including persons living with disabilities, elderly persons, young children, and women and girls in menstruating age. Hygiene commodities needed should be assessed along with the vulnerable users. Because of COVID-19 movement restrictions, women and girls may lose or have limited access to menstrual hygiene management commodities and information as well, with consequent health risk and dignity impairment. For the same reasons, access to hygiene commodities for children with specific needs may be limited. Bedpan, nappies, body lotions are some of the examples. The main takeaway points to retain for WASH and IPC response to COVID-19 in densely populated settings are the following. Design preparedness and response plan to mitigate secondary effects of COVID-19 on WASH services and commodities. These impacts are expected to be strongly affecting high density settings. Adapt activities to comply with National Public Health Response Plan, in particular with social distance, and be inclusive, particularly to those groups who will be impacted by the COVID-19 primary and secondary effects. Engage with all the groups representatives within the settings to assess needs, design a participatory response to COVID-19, and also monitor the response. Points of entry across borders can pose very high risk of transmission due to lack of adequate number of facilities and the increased queuing time to get across administrative procedures. In these locations too, it is absolutely critical to ensure appropriate IPC and WASH, both from an access point of view and physical distancing. The next topic within the IPC and WASH module goes into a bit more detail on this, on how it is possible to achieve this. It is important to reference the RCCE module that was completed and the CHP module that follows this to look at synergies and integrated activities. Also, please refer to the developed list of resources. Thank you.